Welcome to Inform TV. I'm Alan Repke, Alexandria, Minnesota. Today, this third day of January 2014, we're going to talk a little bit about health care again. We continue to see on the news the problem the president's having with his Affordable Care Act, Obamacare, whatever you want to call it. We continue to see issues with MNsure. You know, we have talked here. I offered when I was on the IDS there for about a month before an engineer screwed things up for me and a couple other parties. I told him this April they got fired. I said, just talk to the camera. You have people, what does it show? The low-income people, a lot of them, especially in the Twin Cities, don't have access to the internet. They can't afford it. This program is to help the uninsured. And the uninsured, I'm uninsured. I'm putting every resource I can scrape together to try to see that people are informed of what's really going on and challenging the system. So good people like yourself, whether you're rich or poor, black or white, can get some insight in what's really happening in our system. And this health care deal is a prime issue, and the only way you can do it is to get a true press established again. And this April they got fired, and rightfully so. I told those guys, you go to the Capitol, to Media Services there, and do a program twice a week. I'll put it on Inform TV for a half an hour in a loop 24/7, and they couldn't get that through their thick skulls. And obviously I think it was great that they fired her, but a bunch of the other people should be gone there as well, and tried to get some revenue from them. Oh no, you've got to wait till March before you can get any revenue, that type of thing. And what has happened in this? We haven't had good reporting from any of these media outlets other than we know it's a disaster. Well, if you looked at it, and we talked here on Inform TV, we put a program together with the Douglas County Democratic Party, and we didn't put a program together with them. I guess it's better to say they had a program, and I just went in there, filmed it. They were kind enough. It was 2 hours. A former hospital administrator, a couple doctors. One of those doctors worked for some organization that helped to bring regional care and those type of thing, but none of those three would ever come back and just sit down with me and address the issues that they rightfully brought up, that there was no cost control in this, and it was more of a pipe dream from a standpoint of we want affordable care, but there was nothing in the fine print, so to speak, to address that. And I've said here, as a low-income person at this point in time, to the point almost no income, that we should simply go to universal health care, just like Europe has had, Japan has had, Canada has had. Put a hybrid of the different programs together and be insured. And if you want to buy a Part B or some supplemental insurance for specialists and high-cost treatment, fine and dandy. But we, as supposedly the most developed nation in the world, should have everybody with dental care, everybody with health care, to not necessarily give them transplants and all this type of thing if they've smoked all their life or drank or abused themselves or whatever, but to see that they have a fair shot at being healthy for their entire life to the best of our abilities. And especially for folks at least were blessed with good genetics like myself, and haven't needed, knock on wood, to have insurance in the first place. But what I want to touch on a little bit today is the fact that you people here, remember I said I went to the hospital here and asked those guys this because back in April I put on a meeting. Actually, I think it was the annual meeting, so to speak, or the financial report of 2012 that our county commissioners were all at, the rest of the hospital board, which Kevin from the technical college is on, David, the former retired now, I guess, Bremer banker here in town, and I'm not sure who the other individuals were that are not involved with the hospital. But anyway, covered that. And one of the people in that shoot had requested a DVD of that, and I said, well, just get me on Charter and everybody can see it. But it wasn't her fault or anything like that, but everybody's always asking me to do this, and so I said, when I find it, I'll do it. And just the other day I found the tape when I was cleaning some space out of my computer, and here's this meeting. And so I did it for this Nancy that you're going to see here in just a few minutes. Her presentation and the questions by county commissioners, board members, both from the hospital administration as well as Kevin, and I think Charlie was one of the persons throwing a question at her, and how our Douglas County Hospital is handling the uninsured. And it's a very interesting discussion, and I want you to listen closely. I wasn't set up right. That was the only time I've been there for that. I'd like to go back again, but as far as sound, but I think I brought the sound up enough that you'll be able to hear it. You might have to be ready in a few minutes here to turn up the sound on your TV. But it's the discussion about taking care of the uninsured here in Douglas County, and some of the things we're doing, and rather than writing off 5% of the gross, we're only about 1% or a little over 1%. And listen closely about some of the discussion in here relating to the Affordable Care Act, kind of a pro and con, where one of the hospital administrators said, well, it's still going to take us a lot of time, and Kevin, who I think is a good Democrat, brought up, well, we should revisit that. And when Kevin said that, that's why I walked down to the hospital here right along Broadway and went in there twice. Can you guys sit down in a camera and explain to me and my listeners, the people of Minnesota, people of the nation, which program best protects our local doctors and especially our hospitals, and when we have county hospitals like this, or with the Sanford group that I'd like to get some advertising out of, they don't seem to want to do it. We've got the University of Minnesota, we've got Mayo Clinic, those bigger organizations and hospitals. I think the Douglas County Hospital would be a great place for the Douglas County Democrats to send this tape down to the Minshew people, to Dayton himself. Bring those Democrats out here to the land of Republicans and Tea Partiers, and see if you can tell us which plan that would best protect Douglas County. And if it would protect Douglas County, I would contend it would probably protect all the counties that have county hospitals or nonprofits, hospital like many of these others are, yet the cost is out of control. I've always scratched my head. How can we keep talking about nonprofit hospitals and clinics and that type of thing, and the costs are going out of control? I guess that's a topic for another day. But anyway, I approached this whole process, and here's what I started. This Eddie, their communications officer down there, but first I talked to one of their financial people or assistant administrators about this, so I went to two sources. I'm not trying to bash any of the people in the hospital, especially this Nancy that asked for just a tape of how she presented herself and our DVD, and I gave that to her. But it's interesting. But here's the smoke I always get, and you guys, I walk around town, I go in my daily life, and I'm an observationist. I listen to people talk and how they refer to, well, my insurance agent told me this, and my lawyer told me this, or my supplier told me this. Business today blows so much smoke in people's face. It's about time businesses are once again like the days of my youth when businesses were square shooters, and they told people the truth when they asked them about something. But anyway, here's what Eddie from the communications guy from our hospital said when I requested that. And we had a nice little discussion, and I said, I'll bring the camera in there. Oh, that sounds fine, well, but we'll have to talk it over. And then he writes me back this. Thank you for stopping in last week and inquiring about some MNsure information, and this was back on December 9th. And the Douglas County Hospital. After discussing your request with some of our staff, I think it would be more prudent for you to ask these questions to the MNsure navigators. I've never heard about the MNsure navigators before, but basically all it is insurance agents who are trained to answer questions regarding the different insurance plans offered through MNsure. That wasn't my point, and I talked to them plain and simple. I was saying, how do we protect society from people that aren't insured? When they have a health need or health emergency, that was the whole point. And anyway, then he goes on to say, I've attached a list of MNsure navigators to this email that I was able to find on the MNsure website, quotes, no easy task, by the way, and I know that. Everybody just went to that MNsure or Obamacare websites. They're a disaster. I've discussed with Douglas County Social Services as well as the navigators are the most informed people to answer your requests. They don't know anything about the hospital. These hospital communicators, the administrators, our county commissioners are on that board. They know what's going on, especially when you listen to this 8-minute clip. And when any of your county commissioners or any of these board members or anybody from the hospital or any of our elected officials in this area say, we don't know what Rupke was talking about, listen to 8 minutes tape. They even brought it up in April. And when I go back in November and then in December, here's the baloney they blow in my face. Thank you again for your inquiry and good luck with your reporting. Duh. And all he sent me is this list of Bill Mark, Lakes Area of Insurance, Delney Zimmy Insurance, and Iverson Insurance, and Larson Insurance, and Martinson Insurance, and Soderholm Insurance. All these insurance agencies in town are living the high life, and every time you walk through the door and buy something from them, they get a cut of the check you send for your premium. And that's not solving the problem. Why did the Democrats and Obama propose something different? Because healthcare and insurance in general is totally and completely out of control. And instead of doing what I asked, let's sit down. Which of these 4 plans best protect our hospital and society from the uninsured so that everybody is insured in some form or another? Take a listen and listen quick to this our 8-minute tape and listen closely. I think the sound will come through. I'm feeding a direct into a cut in the tape here, so but listen to this. Your hospital administrator, Nancy, who handles these people on a daily basis, and some of the questions from your board members. And you'll see how totally and completely appropriate I was when I went back and say, okay, we're in this trying to make sense of this MNsure stuff. Which is the best policy? Or when everything is confused on the national level, the state level, the local level on this, why don't we put it down to 1 or 2 choices for the uninsured and be done with it? That's my whole point. We'll be back in a moment, but listen to this cut.
Okay, Nathan, would you like to introduce our guest speaker today?
Yeah, today we have Nancy Jennison. Nancy, just first off, come on, what a wonderful job her and her staff do. As you know, when patients come into our facility, if they don't have insurance, they worry about their bill. They worry about how are they going to pay for this. Nancy's style that she uses with the patients, I'll let her explain, but it's one that works really well.
Well, our hospital isn't in business to collect money. We have to collect money to stay in business. And we try to do that as painlessly as possible for our patients. We we help them, give them financial counseling, help them set up payment arrangements, we help them apply for assistance, and just kind of help them navigate that part of their medical stay. A patient is uninsured, they receive our uninsured discount of 38%, which is very helpful. Basically, we just work with them the best we can and let them know that we're here to help them, that financial counseling is part of their care. And we just have an open door policy. They can stop in our office anytime, and they can contact us if they run into problems making their payments. Actually did bring some applications along so you could see kind of what the patient goes through and what we help them with. The medical assistance applications I help them fill out, and we send them over to the courthouse, to Douglas County Social Services for processing. And then if they're approved, then we go ahead and send the bill to the state for them.
If we have someone that says wants an elective procedure, and so they'll ask, well, how much is that going to cost me? Who's the point of contact, and how accurate can we be about letting them know how much it's going to cost them to have a procedure done?
We don't have package prices for surgical procedures, so what I do is I run a listing of patients who've had a similar procedure, and we kind of average those out, and then we explain that to the patient that, while no two patients are exactly alike, we can come, within usually a couple $1,000s of what their procedure might be, depending on what it is.
Nancy, when patients are in-house, or as inpatients, they don't have insurance, what do you do with those patients?
I get a census in the morning, and if someone is admitted, if a patient is admitted that has no health insurance, I go up to the floor and check with the nurses to make sure that they're up to discussing finances, and usually they're concerned about it and worried about it, so it kind of puts that part of the whole situation at ease for them. And I just kind of walk through the process with them. I give them my card, and then I encourage them to contact me once they're feeling a little bit better, and we can kind of wrap up the application process. Quite often I'll help them fill out an application right at their bedside, and then we fax it over to the county that they reside in.
That's what I said, that's not typical of all hospitals, and that's something that we do at our hospital as a courtesy to the patients. I think it's reflected in, you look at a percentage, what is the average percent of gross charges that actually go to bad debt or to charity care? And the average right now is 5%. Our percent is about just over 1% when you average those two in. Now, when you have 260 million in gross charges, and if we were at 5%, that'd be 13 million that the average hospital would have at that. We're just over $1 million right there. So it's just that work that Nancy and her staff does that's a little bit different than our facilities. Helps the patient through this process.
Nancy, can you talk a little bit about the charity care guidelines that we follow in the facility for uncompensated care?
We do. We check the federal poverty income guidelines every year. They go up just a little bit, usually about 3 or 4%. And our guidelines right now are about 154% of the poverty income guidelines. And that way, sometimes patients don't qualify for medical assistance, and they will qualify then for our program. Generally, assets aren't too much of an issue. Most of these patients don't have a whole lot of assets, so it's mostly income that we look at. And they may qualify for anywhere from 20% to 100% right off on their bill.
Thank you.
I don't want anybody to have a crystal ball, but how would the Accountable Care Act, affect, this uncompensated care and those type of issues here?
Well, I was at a meeting yesterday where MSure is the exchange that's being set up, the public exchange is being set up, and they went through the 5 different choices that patients will have or small health plans will have. And actually, the catastrophic, and then there's the full platinum, all those. Actually, there is a high deductible associated with those. So sure, they'll pay a premium, but they're also going to have a deductible as well. So that's still going to be a lot of self-pay that's going to be associated with that collection of those accounts. So I think there'll be more people on care, probably be less people that would have to go with the charity care guidelines, but it's just going to be as much work, if not more, for Nancy and her staff and the clinic and their staff.
Madam Chair, Carl, I think as we continue to move through the conversations that you've been involved with, Nate, it might be a good idea down the road to have an update session for the board on what we're learning within that act. Just to be as familiar as we possibly can, even though it's going to be unbelievably difficult, with the impact of that law on the business that we do.
Yeah, sure. And just to add on to Nate's comments about the, the patient responsibility portion, I think is going to continue to go up, and even employers, particularly the small employers who may be paying a higher premium today, may opt out of their own group insurance plans, and their employees may have to go and buy their insurance on the exchange, and likely the insurance that they're going to buy on the exchange is probably not going to have as much first dollar coverage, as maybe what their employer is offering them today. And so that portion will definitely increase our burden in terms of working with that patient. And today insurance companies are obligated to pay within 30 days on a clean claim. When you have a patient that has $1,000 or $2,000 or $5,000 out of pocket up front, most patients don't have the ability to pay that within 30 days. So our cash collection process is probably going to slow down, a little bit, and we're going to have to become better at working with patients up front on making payment arrangements.
Are there any other questions for Nancy?
Thank you, Nancy.
Thank you very much.
Thank you.
Yes.
Well, I hope you listened close to that report. You see what I was getting at? These people talked about it. There was a pro and a con. The administrator side says it's going to be a nightmare for us, and a lot of time regardless. Kevin brought up we should revisit it. That was my whole point. And we still need to revisit it, but we need to revisit it. I'm going to try to get this new administrator, this executive director, to come out here to Douglas County. Or maybe some of you will rent me a vehicle or something and a few bucks for gas, and I'll drive down there and talk to him about the issue we have in Douglas County. If our hospital is getting by with only 1% or a little over 1% of gross revenue write-off, everybody in the country should come out here and see what the heck they're doing. I'm commending them, but I'm picking on them from a standpoint of reporting to you, I should say, of why don't we at least figure out what program we should have. And here's a little discussion I want you to think about in this whole process. When the discussion started, they talked about people that did not have insurance, yet they were concerned about how they pay for that. Where you are in the income scale, everybody tries to compete do their fair share if they possibly can. And one of the first things that Nancy talked about was they write off 38% of the amount. And yet we hear in this tape and we hear in the news, well, the deductible's too much. Well, if we're going to write off 38% of it, if the bottom program has this big deductible or only covers a 60-40 split where the patient's got to pick up 40, if we as the county are going to write it off, maybe that basic program is good enough, at least for the residents of Douglas County, and maybe for others. But if it doesn't, do we need to be advising people that these so-called navigators are nothing but a bunch of damn insurance agents, all living a high life? We should be selling either the gold plan or the silver plan or the platinum plan. platinum plan. I think the bronze is the lowest. And be in that position. That's all I was trying to get out of our county. And when you see your county commissioner or these people that work at the hospital, you know, some of these administrators, you know, Kevin at the VOTEC, you know, Dave, the retired banker here in town, ask them about that. Come and talk to the camera so we, the common people here in outstate Minnesota, can see what you come up with, because that makes a lot of sense. And the other thing they talked about here, that when we look at things, nobody's got a crystal ball, and that's what the administration side, the communications department said. But what did Nancy tell us? I give examples to certain, they'll be within a couple $1,000. I know that, you know that, the administrators of the hospital board knows that. So let's throw a few of these real patients down. That's what I asked of the hospital administration, to take a few key patients, and how would the hospital come out when you put the bronze plan in front of them, the silver plan, the gold plan, or the platinum plan? How would you come out? And very simple question, but it needs to be answered, not just in a Douglas County, Alexandria way, but on a state level and a national level. And then they talked about paying after 30 days, and when you run into low-income people, they just can't come up with $5,000, $10,000 out of your pocket. So from a standpoint of insurance, why are we even offering those kind of programs? You get my point? And then when we look at this, obviously we've got a lot of viewpoints on insurance, but when we put in God we trust on every dollar, shouldn't we do something as people of privilege that know what's going on in the world, has experienced the world, and stop letting our neighbors get beat up, our own hospitals, staff and that type of thing, and costs going out of line? You know, Mary Franson, I ran into her a couple different times, and when are you going to let me in and come and talk about MNsure? And I said, as soon as I get some time here. And then I ran into her again, and I said, you ready to come in? And but I told her every time, I said, you Republicans, you Tea Partiers, what's your alternative? Other than on a national basis, 5% of the gross proceeds of these hospitals are being written off. And we're letting our neighbors and our friends and people our kids go to school with, we go to church with, and so on, are not taking care of their health. You Republicans, you Tea Partiers out there that are enjoying good lives, that are fortunate enough to have good incomes, what is your alternative? And I agree with you. This MNsure, this Obamacare is a disaster, but come up with something that works. And to you Democrats out there, bring these guys out and let's sit down with them and the camera and our hospital administrators here, because I think this new executive director that seems to have a tarnished record as well, let's look at it and let's get some of that MNsure money for Inform TV, and I guarantee you I'll show you a lot of things that's going on in society that we need to address, and we need to address it on the big picture to take care of issues for all of us, whether you're black or white, Christian or non-Christian, Democrat or Republican. Thanks for listening to Inform TV. I'm Alan Repke, Alexandria, Minnesota.